Hi everyone. My name is Luotong Wang, and I'm from Biomedical and Health Informatics program. Today, I'm going to do the presentation of my perinatal research internship. So here is the agenda for today's presentation. Firstly, I would like to briefly introduce about the internship and what I did in this internship. Then a timeline of the whole process. And I would like to display some of my deliverables include some take-home messages from literature reviews and perinatal topic poster. And finally, some of my reflections to this internship. So my instructor is Professor Randall Blanco, and the organization where I took my internship at is UNC Perinatal Research Service Center. Our internship deliverables include two parts. The first one is literature review. We are encouraged to find 4 perinatal research topics to explore. For each topic, we need to find 6 science articles and make spreadsheets to analyze, include central argument, research method, paper summary, and so on. For the second deliverable, there were several choices, and I chose to make a perinatal topic poster because I think it's a great way to advertise perinatal research knowledge to ordinary people who are not familiar with those medical terminologies. This is a brief timeline of my whole internship. During the whole process, we have weekly group meetings to share our knowledge, learn from literature review, present deliverables, and ask questions. I have to say that I learned a lot in this share and learn process because I have the chance to know other perinatal research topics from other fellow interns without spending the extra time reading science articles. And some of the shared knowledge also inspired me in the process of finding my own topics to explore. So my first topic is gestational diabetes mellitus. Before the literature review, I thought it means high blood sugar level during pregnancy, but according to the research papers, it actually means any abnormalities in blood sugar level that occur for the first time or it's first detected during pregnancy. Gestational diabetes mellitus has become a global public health burden, but when I searched for its diagnosis criterion, there isn't a worldwide one. So different countries use different criterion for diagnosis. Gestational diabetes mellitus has severe bad effects in the long term for both mother and child. So it is important to test early and implement interventions in the management. Lifestyle management and medications work together in the treatment of gestational diabetes mellitus. My second topic is postpartum depression. It is a mood disorder, and it is one of the most common medical conditions during pregnancy. But the symptoms can be hard to recognize and diagnose. Some pregnant moms who are experiencing severe symptoms of postpartum depression may have the potential to harm themselves and others. It is noted in the research papers that most intervention studies often focus on mothers with a depression history or a family history of depression. But the data shows healthy mothers without depression history have the same risk of experiencing postpartum depression. So I feel like this group should not be neglected. The treatment focus on medication and psychotherapy treatment. There are also educational and support groups to help pregnant moms against postpartum depression. In this topic, I wanted to explore the influence of COVID-19 on pregnant moms and newborns, and if moms with COVID will have a higher risk of delivering babies with COVID. Pregnant moms are more susceptible population to COVID and other diseases because of the the physiological changes like the alterations in cell-mediated immunity during pregnancy. Newborns are also susceptible population to COVID because they possesses an underdeveloped protective system. It is worried that SARS-CoV-2 virus can be transmitted from the mother to the fetus within the uterus, but there's no solid evidence to prove it for now. Newborns from mothers with COVID show similar rate of testing positive compared to newborns from mothers without COVID. Practical prevention and management of perinatal COVID-19, like regular COVID tests, limiting contact between newborns to other people, the initiation time of breastfeeding are all important to reduce the risk of newborn getting COVID. The research papers also have limitations. The data collected are in early COVID-19 era. The statistics may have changed over time, and there's a lack of detailed clinical manifestations for references. Also, there's not enough data about COVID-19's long-term influence on pregnant moms and babies. In this topic, I explored a new group care model in prenatal care called Centering Pregnancy. It is started by Rising in 1998. The care model is started because of the dissatisfaction with the traditional individual care model at that time. People need more comprehensive, educational, and culturally appropriate care. I thought this was an interesting topic to explore the possibilities of improving perinatal care efficiency. So in this care model, a group of pregnant moms are taken care of by a group of obstetricians. They will meet based on pregnant mom's schedule. The sessions will focus on clinical assessment, education, and support. This care model provides education on pregnancy knowledge, emotional wellness counseling, and it builds a sense of community and provides company. But there are also limitations such as the price for service, lack of trained obstetricians, and privacy concerns. But it's still an effective care model to be practiced compared to traditional individual care model because pregnant moms get more time to communicate with obstetricians and other pregnant moms. They will obtain knowledge through this process and save the time of waiting for appointments. For my second deliverable, I chose to do a perinatal topic poster about gestational diabetes mellitus. I cropped the poster in several pieces to get a clear view in this presentation. I used, "Oh no, I have gestational diabetes" as the title because I think it's interesting and attractive as a poster title. I introduced the prevalence of gestational diabetes to kind of raise the awareness of people seeing this poster. And then I showed some risk factors with small icons. Just want to make it easy to understand and remember. I also introduced some bad effects to both mom and babies. I avoid using hard to understand medical terms and try to use simple and less words to convey the information. And I also noted down here, early testing and treatment is important as a caution to the audience. This part, I introduced 2 most common gestational diabetes tests, and in the same way, I tried to use less words and simple icons to make the process easier to understand. For the management and treatment, I focused more on lifestyle changes like exercises, healthy diet, and staying in a good mood. It is also important to monitor blood sugar level and go to regular perinatal appointments. For the reflection to this internship, I have practiced my skills of communication and presentation in our weekly meetings. By doing the literature reviews, I also practiced how to extract important information from science articles and do summaries. I have also learned critical thinking through this process. No matter if I am doing my own research or just referencing literature in the future, I need to be aware of the limitations. I also met challenges like one time I decided to change my topic because I can't find enough literatures for this topic, but it was so close to my topic presentation date that I must reset my schedule for other things to complete reading articles. And it's also challenging when the exams come and I need to stay on track of my internship plans and review for the exams. But fortunately, I made it. I would like to thank Professor Randall Blanco for this opportunity and everything he did during this internship. It's hard at the beginning because I don't know much about perinatal research, and I did spend some time to learn the terminologies. But it's also inspiring when seeing so much research about improving women and babies' health outcomes. After this internship, I find this is a fascinating field, and I'm really looking forward to contributing my effort in improving the health of women and babies in the future career. So that's what I have for today. Thank you, and I'm happy to answer your questions.